Our secret power is that we then say to them, if you want us to help you get into see a dermatologist, we have a network of 600 dermatologists around the country. You tell us your zip code, you tell us your insurance, and we will connect you with a convenient dermatologist who promises to see you in clinic within 2 weeks.
Welcome to Humanity in the Age of AI. Today, we are blessed to have Steve Bonner, CEO of SkinIO, who has a very, very interesting product in diagnosis of skin cancer and how AI is impacting him. I'm Shubalok G. My grandparents were freedom fighters with Gandhi, so I've always surrounded my career with change initiatives in healthcare. I'm a classically trained tabla player with a side project, Bungee's Delta Blues, and for the last 6.5 years, I've been doing digital transformation in healthcare, and currently I have a very keen interest in the intersection of creativity, artificial intelligence, and great businesses like SkinIO that Steve is leading. With that, Steve, I'd like to hand it over to you. Tell us a little bit about yourself, SkinIO, and your journey to get here and why you're here today.
Wonderful, thank you. So just briefly, I'm the CEO. I'm a recovering lawyer by education. I had my first career in the financial services business, not as a lawyer, but as an entrepreneur. I built 3 multi-billion-dollar businesses inside of big financial services companies, and then in the late 90s was introduced to the founder of a company called Cancer Treatment Centers of America and made the jump to healthcare. I came on as the CEO of CTCA in 1999 and stayed 15 years, built the business from 100 million to about 3 billion, and most of all became very devoted to the concept of breakthrough innovations in healthcare. We all know that healthcare is a huge part of our economy. It's a huge part of our culture, but it's very expensive. It's very hard to access. It's very hard to control. And as a result, quality, cost, access, and outcomes are a challenge in many sectors of healthcare. And I've now built a portfolio of 25 companies that are all targeted to bring an idea to market with a great team that can transform some part of healthcare services, delivery, access, outcomes for the healthcare ecosystem. The SkinIO, I joined as CEO in the fall of 2023. Part of my portfolio of companies have been devoted to dermatology. And I kind of saw this from the other side, where I know millions of people who are worried about skin cancer try to get into dermatology clinics to find out if they have a problem. And dermatologists are so short in supply and so oversubscribed, it takes months to get in to have somebody look at your skin, which may include a possible melanoma, which is life-threatening. Time is not working to your advantage. And so what we have developed, based on 2 applications of AI, is an opportunity for the 30 million Americans who are walking around with undiagnosed skin cancer to be able to access our AI-supported app onto their phone or iPad. And then the technology guides them through capture of 13 images of 13 regions of their body, using the AI to capture high-quality images. So we wind up in 10 minutes with a full-body skin exam at home. And we do on-site events for employers and so forth, but basically you don't need to get into a dermatology clinic. So these 13 images go up into our database, which applies another AI application. Both of these are patented. And what the application in the cloud does is it begins by computing the mathematical equivalent of the individual patient's normal skin. And then it uses the AI to look for statistically significant outliers on their skin. And an outlier might be a freckle or a tattoo or a mole or a piece of jewelry. But from a point of view of trying to identify skin cancer, that's not significant. So we're looking for things that look like they're predictive of skin cancer. And all those locations in the body are highlighted. And then the full set of scans go to our panel of dermatologists who review the scans. And within 48 hours, so 10 minutes to scan, 48 hours to get your report back on the evaluation, the patient is told you're one of three things. Number one, you have no immediate visible risk of skin cancer, so you don't need to go see a dermatologist. You don't need to wait months. But we now have your baseline scans in our database, and every time we rescan you, we'll not only look for those statistically significant outliers, but we'll compare your skin trends and look for changes over time. So it's potentially skin care for life. That's about 2/3 of the people we've scanned. Another 20% will say there's something here that bears watching. It doesn't look like an immediate risk of skin cancer, but whenever you see a doctor, you get in to see a dermatologist, make sure you take your scans and have them look at this part of your skin. And then about 10%, we say there's something here that needs to be seen in clinic by a dermatologist as soon as it can be arranged. And our secret sauce, our secret power is that we then say to them, if you want us to help you get into see a dermatologist, we have a network of 600 dermatologists around the country. You tell us your zip code, you tell us your insurance, and we will connect you with a convenient dermatologist who promises to see you in clinic within 2 weeks. So the from the point of concern to being in clinic, if you need to be, is 1 month rather than 6 months to 9 months just to get in for an initial visual exam, the way the market works today.
That's an amazing product, Steve. I think great utilization of AI and yet still relying on dermatologists in the system. I started a dermatology biotech of my own, wasn't nearly as successful as you, as we didn't get off the ground, but I do know how difficult it is to see a dermatologist. And the figure that you name, that how many patients are out there with undiagnosed, is quite astronomical, quite honestly. What type of roadblocks have you encountered? I know that it's always frustrating. The healthcare system is dedicated to treating symptoms, not preventative. So I'm curious, what type of roadblocks you faced.
So in healthcare innovation, there are a lot of headwinds. That's your point. It's not easy to quickly implement even great ideas in healthcare. And there are good reasons for that, but there are also many costs. And so what have we faced and how are we moving towards it? Number one is the development of our technology and the proof of the quality and the value and the reliability of our technology, and also the security and protection of it. And I won't do a lot there. We're fully HIPAA compliant. We're coming through our first SOC 2 audit. Our app protects the patient information. All of the scans that we take are obviously pulled off of the devices. Nothing is left on a device. It all goes up into our cloud. All protected there. The patient has complete control of their scans. Nobody can see their scans. I cannot see any scans of our customers. Only our dermatologist can see them, and then anybody the patient wants to see them and gives authorization for. So it's fully protected. The quality of our technology has been demonstrated and supported by Stanford Dermatology and Northwestern Dermatology. Both have done studies and issued papers. Stanford Dermatology said that if you go to a dermatology clinic for a visual exam of your skin, the well-practiced dermatologist might approach 80% accuracy. They published a paper that said we hit 95% accuracy. So it is very reliable, very high quality. Northwestern did a study trying to fool our technology into false positives. We hit 100%. They didn't fool us on any false positives.
Amazing.
So it's very high quality. Then obviously the payer community is very resistant of new innovations and especially scanning technologies. They think with scans, all you do is you find the problem, they pay to find the problem, and they don't get the cost or the value of solving the problem. And we close that loop. We actually help people get into treatment much more rapidly. And skin cancer, the most prevalent form of cancer in the country today, but easily diagnosed, easily treated, and much more efficient from an economic point of view and from a human point of view if you can get it into early treatment. And that's what we do. We take months out of the equation. We've worked with an independent actuary who's built a model, and we can take populations' predictive skin cancer data from their population, age, gender, ethnicity, history of skin cancer, history of cancer, put it in our model, and we can show the employer the ROI they'll get over 5 years if they start investing in our scanning technology today. And if average incidence is present, you should get 2.5 to 3 times a return on every dollar you spend in SkinIO scans over 5 years. The industry, the ecosystem is not used to looking at benefits that way. They don't believe that they're actually going to make money by spending on a health benefit. So we've got that educational process to work our way through. We're finding some wonderful, insightful early adopters. United Airlines is our biggest customer. We've scanned over 10,000 of their patients. We found many of them much higher incidence of skin cancer in the airline industry, both because the crews are all flying closer to the sun, but they also have all these ramp personnel that are in the sun all day. So we're getting, we've got about 60 corporate customers now. We're getting ready to move into the direct-to-consumer market. Another headwind is that 80% of the counties in the U.S. have no resident dermatologist. And so, if you're in Philadelphia and you happen to be in a nearby suburb where you don't have one in county, you can still get into the city to see one, but many people are 3 hours away from a dermatologist. And so giving them this kind of technology to help them understand that they need to do a 3-hour drive is another shift in the way the market works and the market behaves. And so there's a lot of education here, is what I'm saying, education on the problem and the technology and the access to the technology. Our pricing is, we think, very attractive. We have basic pricing of $239 for each completed scan, and that includes everything from the download of the technology to the conduct of the scanning event to the review of the scans, dermatology review, and into clinic if you need to get into clinic is all for $239, which again beats the way the market works today on cost. The initial 15-minute visual exam in a dermatologist office costs around $250 to $350, and you also have the cost of taking time off work, going to the clinic, sitting in the clinic for an hour, waiting to get in, waiting to get out. So all those soft costs are also saved in our model.
Got it. Thanks for sharing the United Airlines. A couple of questions come to mind. Number one, what was your pitch overall to them? And I'd like to learn a little bit more about your B2B strategy, and also how come you're making the shift to consumers, because that type of ROI that you're talking about seems like it would hit home with payers,
Yeah, it's not a shift. It's an extension.
Extension, got it.
We're not abandoning the market. And I'll also just mention, we also have a growing presence in primary care clinics.
Okay.
Where the annual exam, the patient comes in to see their doctor and says, I'm worried about skin cancer. What can you do for me? And the doctor says, well, here's a referral, go get in line and see this dermatologist. And now they can, on day one, they're getting all the blood draws and the lab values. They conduct our scan events. The patient comes back 2 days later, and their physician can now inform them about their risk of skin cancer and can use our network to get them right into care if they want. So there's a clinical application that will add real value as well. But
does the doctor actually use the phone to do the scan, Steve?
They can use their phone or they can use an iPad, whatever,
or an iPad.
whatever they like.
And
yeah, exactly. Yep. And it's not the doctor, a mid-level can do it. We'll come in, we'll install it in their technology system, and we'll teach a mid-level how to do these scans. And the patient can come in and go right into a conference room and get scanned before they go in to get their blood draws done and so forth. So it's very friendly and very easy and very efficient in a clinical model. Dermatologists ultimately should have this in their offices, and then they don't need to see these people who don't need to see it. The patient can get scanned at home as a part of the dermatology clinic process, and then they can bring them in to the clinic if they need to be. But otherwise, they're building this wonderful, easy to access relationship with patients in their footprint. So it's very easy to use. You mentioned the B2B model. I agree with you. More and more businesses are, if they're self-insured especially, they're more focused on wellness and well-being. They're doing wellness events. We fold right into that. We can have our team show up with privacy tents, anywhere from 1 to 8 privacy tents. We'll have scanners with our iPads, and we can move their employees through these 10-minute scanning events right on site, which is very efficient. With United Airlines, every year we set up our tents in terminals, and crews changing flights and getting ready for flights, as well as the ramp personnel, can come in and have an appointment, get a scan, and then move through the process very efficiently as well.
Hey, Steve, so do you want to talk about Medicare now? That's what's on my mind. Do you want to talk about the outcome studies at all, or why that's not working, or go somewhere else?
Well, sure. Okay. Yeah. Let's go there.
Let's go there.
Okay. Yeah. Yeah.
Okay.
So another dimension
Let me ask the question.
Yeah. Okay.
Steve, you talked about an incredible ROI model as well as outcome studies. I'm curious, what is Medicare's response to these studies and your overall value proposition?
So Medicare is not going to change their ecosystem for us. At the moment, we can use a couple of codes that are relevant to skin cancer scanning that gets us some reimbursement. But the real breakthrough with Medicare, and to some extent with the private insurance companies, will lurk with our strategy to recreate our FDA classification. And at the moment, we're FDA Class 1 registered, which means we're on their screen. They have oversight on what we're doing. They've looked at it. They agree that that's a good place for us to be. But our strategy is to move towards de novo pre-approved classification by FDA, which, as I'm sure you know, really puts some wind at our back from a reimbursement point of view. Absolutely. And we've looked at companion technology to see if indeed we are de novo. Our experts think that we are de novo, nothing else like us in the market. We've got the 2 studies I mentioned. We've got a lot of real world data. So we think that we have a good shot at moving through that FDA process in maybe a 6-month period and getting de novo pre-approved status. And then that opens the door to getting our own reimbursement codes with Medicare, which is obviously another frontier that if we can move our way through it, will be very advantageous.
And if you do get that in the 18-month horizon, what's that going to do to your business? Double it? Is it, a marginal increase, or what type of horizon are we looking at?
Yeah, that's a multiplier, I think, not only with Medicare, but with the private insurance companies that would then be compelled, to accept some of those same codes and move us through their claims processes. The population for skin cancer has tended to be an older population, so obviously that's important to Medicare. But the trends, interestingly, are going the other way. Skin cancer is showing up more frequently in younger people, and especially in younger women.
Okay.
And we don't know why.
What age group, approximately?
I'm down into the 20s,
Really?
the 20s and even 30s, yep. And, I wonder, what all we've done to our bodies with all of the COVID inoculations. We didn't really study that very well. You wonder if somehow that's increased sensitivity.
Oh.
certainly younger people like to be outdoors, and they are outdoors probably more, probably not as tuned in to protecting their skin. And obviously, that's the other part of it: protect your skin and check your skin and get it treated. And so there's an educational front end on that for the entire population to become more diligent in protecting their skin when they're going to be out exposed to the sun.
Got it. I'm really curious from your business model perspective. There's so many employers out there. There's so many insurance companies that could utilize this, right? Especially with an ROI like you talked about. How do you actually go about segmenting where you're going to pitch?
It's a combination of network and word of mouth leveraging. The White House has hosted an annual moonshot on cancer for many years. And United Airlines was there 2 years ago and got up at the end and said that they found the right partner for skin cancer breakthrough and identified us. And we got a number of calls and have gotten some nice business out of that. We are appearing at different conferences and advocating for this, employer conferences, union conferences. Unions are also very intrigued by what we're doing, and we've got some big union partners. And then, the bullseye in the employer population are self-insured employers. And so we're constantly looking at ways we can get into conversations with self-insured employers. We have a new partnership with Memorial Sloan Kettering Direct, and they're very excited about introducing us to large employers in their ecosystem who are worried about skin cancer. We've got 3 new employer relationships. We've got a big event to do 270 scans in Nashville next week with one of their employer members. And Memorial Sloan Kettering did a really neat white paper for us, didn't publish it, but just for our conversation, in which they said that all of this initial assessment of skin cancer does not belong in clinic. And they said they've got their own skin cancer clinical team members, and to have them wasting their time doing these visual skin exams that are 80% accurate when they could get them doing it using our technology and then find the people that really need to be with a dermatologist and getting them in care is the future. So those kinds of highly influential top brand relationships are things we try to move towards very quickly and then come behind with an expose on what it is we're doing and the value of it and give them a chance to come into the ecosystem. The airline industry has got higher incidence of skin cancer. We're in conversations with 5 airline companies, in addition to United, where we have a contract. Outdoor athletics, sports, professional and college sports are another big target for us. Justin Thomas, JT, who's one of the top golfers in the world, had a melanoma on his leg, had it removed. He's started an initiative in which he's talking about protect your skin and check your skin. We're looking at a partnership with him to become the check your skin part of his extension. We've had conversations with the Arizona Diamondbacks. We're talking to the Brooklyn Dodgers now. All of their population, both on field and also their office population, which tend to be more athletic and be outdoors, is another important target for us. Obviously, soccer, football, all these things are markets we're trying to find introductions and inroads into to extend our reach and our value delivery.
So it sounds like the majority of your marketing is coming from word of mouth. Are you, obviously AI is a principal part of your business, but are you using it in marketing at all?
Yes, good point. So our applications of AI include the 2 that I mentioned in our technology, but also we have 22 employees, 6 of them are engineers, and we're also using AI coding technology to make our engineers much more productive as we continue to refine the product. And then we are using it in both our on-site delivery for employers and also using AI into the marketing and the direct-to-consumer front.
Fantastic. So, you've got 25 portfolio companies. You've got this great experience growing treatment centers of cancer in the United States. If you had to look into a crystal ball, what do you think it's going to look like in 3 years? Is this AI for diagnostics like telehealth? It's going to be part of standard medicine in the future. I don't think any of us predicted how well that would do. Or is this still going to be niched in 3 years, Steve?
I think it's going to be a very important pillar of healthcare going forward. And, it's not, I don't think it's going to replace doctors. The saying is that AI won't replace doctors, but doctors using AI will replace doctors who are not using AI in healthcare. It's such a much more effective use of technology to enhance and augment what we can do as human beings. And our example of a visual exam by a doctor proven by Stanford Dermatology is a great example of that. The cost of getting in to see a dermatologist, taking 15 minutes of their time and getting 80% accuracy compared to having them say, before you come in, you download this technology, do the scans, and let's find 95% accuracy, and then we can decide how to take care of you in clinic, is a win-win for everybody. It's just a huge advance across the quality, cost, access, outcome spectrum. And so I think that's a great example. And I think there are others where one of the good news things about COVID, I think, is it pushed our thinking in terms of what really needs to be seen in clinic, physically by a doctor. And how can we open up the use of technology and communications to help people come up the healthcare curve more efficiently, more quickly, more accurately, without having to get into consume clinical pipeline resources in healthcare.
So, Steve, I don't know if you're going to want to answer this one, but who needs to buy you? I mean, you got a great product, you got great adoption. I mean, who's out there that needs to take a look at you?
Well, I think any big technology platform that's focused on healthcare could get excited about including us in their portfolio and buy us or partner with us, whichever one we can make work. Um, it's also, I just mentioned, this is an international problem as well. This is not a U.S. problem. Every country in the world has a growing presence of skin cancer. Australia and New Zealand have the highest incidence of skin cancer in the population, and they're all short on dermatologists. So while we're focused on the U.S., we'll take the opportunity at the right time to bring our technology into some of these other countries. I'll also mention that our technology is scanning skin now for skin cancer, but it can scan skin for other things. And we've had an overture from Johnson & Johnson's Skin Innovation Lab where they're wondering if we could support their clinical trials, skin clinical trials, by scanning their in-trial population at home to see what's going on with the skin. And we know the challenges with clinical trials are, number one, finding and enrolling qualified patients, and number two, patient compliance once they're in the trial. And with skin trials right now, you got to go into the clinic to see how your skin is doing. And that creates a barrier to compliance. If we could just scan them at home, there'd be an advantage there too. So our technology is expandable, extendable both vertically and horizontally, and a smart, innovative, well-funded healthcare technology system could get excited about bringing us into their portfolio. There's also the question of, would we want to sell? And I'm a builder and an innovator and a developer. I'm not instinctively inclined to sell a great idea. Once you've proven it, you're getting it into the market. Why would you want to sell it and let somebody else take all the advantage of the upside? But I'm not my only shareholder either, so we'll get others into that conversation when we get an offer.
Thanks for giving us some insights there. It's always interesting when you've got such a great idea, what that path might be. So one question we ask all our guests is, we've heard a lot of the differentiation that you have in the marketplace. Obviously, you've got a great background and experience in finance and in healthcare now. What is your superpower, Steve?
My superpower?
Yes.
Or SkinIO superpower?
Well, I'd like to
I
hear about
mean,
you personally and how it might relate to SkinIO.
great. Well, I mean, my superpower is number one, a huge passion for transformational innovation in healthcare. And that's what we did at CTCA. We had a very unique care model and a very unique business model. And we were poo-pooed and pilloried by all the traditional players. We proved the science, and now we've transformed cancer care, in-clinic cancer care across the US. When we came, it was, surgery, radiation, and chemo. That was it. We said, no, you need to supplement all that with a fully integrated, holistic system of care, because those things are assaulting the immune system at the moment in time when you want the strongest possible immune system. So we said nutrition, naturopathic intervention, psychoneuroimmunology, exercise, diet, nutrition, dietary supplements, humor therapy, laughter therapy, pet therapy, architecture in the healing environment. All those things need to be integrated with the traditional three pillars of care. And all the players, when we came in, said there's no science behind that. We did the science. We proved it. We published it. And now you can't go anywhere in cancer care but what you're not offered these important complementary therapies. So that's my big learning experience, and I'm constantly on the lookout for those kinds of ideas. And so my 25 companies all are proven to me to be great ideas that really can make a significant transformational difference, not incremental, but transformational difference. Talent is critical, the team around the table, IP, use of technology, AI, machine learning are these things that are really going to extend it. Obviously, capital access and availability. And then when I invest, I also want to not only invest money, but be convinced I can add something to the journey. So I become a board member and an advisor. So that's kind of my secret sauce in finding ideas and then helping them move them through the market. We've talked about the headwinds on innovation. So hopefully I bring some experience with that. And the SkinIO superpower is this complete, easy to access application of technology that allows you to assess the problem, and if there is a problem, get into clinical care almost immediately in skin cancer. And there's nothing else like that, nothing else that finds the problem the way we do. There are mole picture taking telederm applications where you see a mole and you say, what is that? And you take a picture just on your camera and send it in. There's no AI, there's no technological assessment of it. A doctor looks at it and they say, yeah, you got to get in to see a derm, and now you're back on your own. But that's what you can see. We had a wonderful United Airlines employee walk up to our event in the San Francisco airport last spring, and big smile on his face. He said, I'm Scott, I'm back, and you saved my life. Wow. And we said, okay, how did we do that? And he said, well, I came in for a scan last year because I saw something on my arm I was worried about. That turned out to be nothing, but you found a melanoma on my back the size of a fist that I didn't even know I had. And we've found it early, we intervened, it's gone, and I'm cured, and you saved my life. And so our technology in terms of comprehensiveness and the use of technology to understand what's there is also our secret sauce. But then this connection to care at the back end, nobody else is doing anything like that in skin cancer. And I don't think anywhere else. I think all these scanning technologies say, yep, you got a problem, go see a doctor. But how do you do that?
So, Steve, if any of our audience wants to get in touch with SkinIO, how do they do that?
Our website is skinio.com. And my email address is steve@skinio.com. And so we'd be happy to hear either, with a chat on the website, but better yet, shoot me a note and let's figure out how we can take a step together to help more people get a solution to skin cancer they don't even know they've got.
Fantastic. Steve, it's been an honor and a pleasure to talk to you. We at Humanity in the Age of AI really appreciate segmenting where AI has a place in their business, and yet there's still a major reliance on the dermatologist, which is people. And we truly believe that people are still the future. Really appreciate you sharing insights on your career, your portfolio, and everything I know from my experience at J&J and Merck and the startup world. And, I think you've got an FDA impact that's going to exponentially increase your business in the future. So I wish you the best, and thanks so much for joining us today on the podcast.
My pleasure. I hope it's helpful to some of your audience, and we're going to keep moving this to a place where it belongs.
Fantastic.